Hi guys, welcome to day number 3 of the podiatry practice blueprint. I'm excited to have you guys back. I'm going to get right into some content today because I know up to this point we've talked about like this before, during, and after. These are all concepts you can journal about and kind of work on. We've talked about other type of kind of mindset topics, but today I want to talk about something that's real passionate to me. This is my idea of the patient presentation. So if you've heard some of the other things I've talked about, this has been like the one practice changer that's really made my life a lot better. I want to tell you a little bit of a background about it. Basically the idea is when you're seeing patients, you pull up PowerPoint or Google Slides and you use that to explain certain diagnoses. Now this can make it a lot easier if you're seeing people with Achilles tendonitis or plantar fasciitis or other types of conditions. The story behind it is when I was doing when I was doing a surgery, I had kind of an allegation about having a poor outcome, right? It happens to some of us. And they said, well, you didn't really go over the pre-surgical discussion with the patient in depth. Like they sign the thing before they go into surgery. But then I kind of thought back, well, I can't really change what happened, but I can change what I'm going to do different in the future. And then I was thinking, well, if I could do it different, what would I do? And basically, I decided that I would do this pre-surgical discussion with people. And then I realized that my discussion really wasn't the same for everyone. I had it on my consent, that it was similar, but it wasn't really the same for every single one. And so I made up a kind of a simple slide deck initially. And I'll try to find the original slides and I'll kind of post them. And then you can see the ones that I use today. So this is called my pre-surgical discussion. This is for you guys to use. You just go to the download section right underneath here. You can download the slides, the pre-surgical discussion, if you want to use it. What I do now is for every surgery, I will review these slides with the patients. Okay. And it's made my life so much easier, and it reduces the risk of litigation. I can document that I showed them the slides. And then I'll kind of get into later how you can use those. But I just want to initially show like these are the slides. And then from there, I was like, wow, this is great. Maybe I could do it for other diagnoses. And that's where my first one was plantar fasciitis and then Achilles tendonitis, because those are the two that are more complex and they have a lot of treatment options and things like that. But I just want to introduce this concept of patient presentations, and you might want to consider it. So what I would say is I would go down, you can hit that download button and you can get I'll put version 1 of my pre-surgical discussion, and then I'll put the current version that I'm using, and you guys can feel free to use it. I would recommend if you're going to use it, just save it on your desktop or even save it to like your browser or somewhere that you can get access on whatever computer you're using. And in future weeks, I'm going to go over ways you can build on the patient presentations. Also, I'm going to put down here a link to a couple of resources. One is kind of a way that you can make your own patient presentations. It's kind of an outline of how to make them, and I'm going to go over those in future days as well. Okay, so I hope you guys like this. Let me know what your thoughts are. Also, if you want to share these things with your friends, you can share your login, but it's probably just easier to invite someone. There's a place you can put either 1 to 20 emails down there of different colleagues, and I'll send them an invitation, and then I'll invite them to this course, and then they can do it. You can do it with them. In terms of the patient presentations, put some comments down there what you think or what other ones that you would like. Okay, because these are eventually they're kind of turning into a course. I'm going to put some of them down here though for you guys to try and see what you like. Okay, once again, hope you guys enjoy it. I'll see you guys tomorrow.